elderly, patients with colorectal cancer or bowel diseases, and women who've had many children are all at risk for a debilitating and embarrassing condition, bowel incontinence.
It is actually more prevalent than people think. It's one of those taboo topics. Nobody wants to talk about it.
In the U.S. alone, an estimated 18 million people suffer from it, similar to bladder incontinence, only they're unable to control a bowel movement.
There are several factors that lead to fecal incontinence. Tears during childbirth, for example, or they've had surgery in the anal rectal area, then they can sometimes have injury, or nerve damage.
Bowel incontinence can be occasional or consistent. Depending on the severity, some people are able to keep it under control through non-invasive methods.
The first thing that we tell people is to change their diet first. We try to bulk up their stools with fiber supplements initially. And also, people who have fecal incontinence, they've learned to time their meals so that they don't have a big meal before a social event. Sometimes we try to constipate people with antidiarrheals. And then we also send them to biofeedback therapy to strengthen their muscles.
If those fail, the FDA recently approved a device called InterStim. It's an implantable nerve stimulator which helps the body maintain control in the pelvic region.
There's a testing period for 2 weeks, and then if it works, and if people are showing that there's decreased in their incontinence episodes, we implant it and see how they do.
A pacemaker for the pelvis. The device goes under the skin near the buttocks and delivers patients mild electrical pulses.
It gives them more tone in that area, whereas people who are incontinent generally have very weak tone. And that's sort of the benefit of the device.
All options for people held hostage by their bowels. For Lee Memorial Health System, I'm Amy Osher.